Every Monday, we share a presentation with our community. These presentations offer a sense of our thinking at any given moment, and they help to communicate the public health issues that all of us are working through and a sense of how we at Georgetown are navigating them. In our time together each week, I'm able to share with you some of the trends that we are tracking globally, nationally, and locally, and some of the emerging developments in our understanding of COVID-19. And we focus on our community, what is happening here at Georgetown. These past 2 weeks have been the most challenging we have faced at Georgetown. 2 weeks ago, we began to see a significant rise in positive cases of COVID-19. Many of these were among students living in the Georgetown neighborhood. As a result of these cases, as I shared last week, we made the decision to greatly limit in-person activities on our main and medical campuses. Our plans to open some study spaces have been put on hold while we manage this spread in our community. These steps will remain in place until February 15th. We're tracking the current trajectory of cases closely and will reassess where we are at that time. We've also encouraged our community to limit their social gatherings and to adhere closely to the public health measures of our community. Last week, we saw 109 cases among our community. As of today, we're still seeing higher case counts, especially when we compare to the fall semester. To put this current moment in context, I've asked Dr. Ranit Mishori, who is serving as our Chief Public Health Officer, to join us for a conversation.
Ranit, thank you for joining us. Now, I wanted to ask you to speak about your impressions of the pandemic at this moment. Cases have come down slightly from the high point that we saw in early January. We're seeing the vaccine delivery accelerate across the country. And at the same time, we're seeing the emergence of new, more transmissible variants of COVID-19 beginning to circulate in the United States. How would you describe where we are at this moment, both nationally and here in the DMV region?
Well, I think it's a mixture of cautious optimism, but also some concern. The cautious optimism is because we are seeing a lot of the case numbers throughout the United States going down. We're seeing fewer numbers of deaths. We're seeing fewer hospitalizations in the United States as a whole, and specifically in our region in DC and Maryland and Virginia. Now, there are some variations by state and by region, so this is not uniform, but overall, it is a downward trend, which is making us all hopeful. At the same time, we have to remember that these numbers are still much, much higher than the number of cases we've had in the summer bump in July and August, and also at the beginning of the pandemic in the spring of last year. So good overall trend, but our numbers are very high and the pandemic is still raging in the United States.
Thank you. Now, we've talked often about the different populations who are most impacted by the worst effects of COVID-19. What do we know about who gets COVID-19?
I think we can look at it in two ways. If we're looking at it by types of population, there are a few communities and populations that are disproportionately affected by it. And by affected, I mean both populations that tend to be more at risk for the virus and also more at risk for death and severe disease. These populations, not surprising to anyone, are Black and other communities of color, indigenous populations, Latinx populations. These are people who have both higher risk of getting it, or getting it in larger numbers, and are bearing the burden of more death. That is not unusual. The United States, we've seen such health inequities and disparities for many, many years. They are linked to all kinds of systemic systemic racism and discrimination. So it's not surprising, although it opened our eyes. I think a lot of people, it opened their eyes to the reality of healthcare in the United States. We can also look at it from the age perspective. And what's interesting here is the group of primarily younger people, age 20 to about 39 or 40. They are, in terms of the numbers, they have a higher proportion of cases. So they are driving the disease across the population, but they are not the population with the highest number of deaths. That is reserved for people over the age of 60. So there are different ways of slicing the data, but I would say overall, older people are disproportionately dying from the disease, and younger people are responsible for spreading it throughout the population.
Let's turn to our community. We've been monitoring closely this rise in cases, particularly among those students living in the Georgetown neighborhood. Could you talk about the experience of the past 2 weeks and how we have been responding?
Well, it's been exhausting for everybody. The past 2 weeks have been unusual in that we've seen a very, very large increase in the cases, particularly in people living outside of campus in the communities adjacent to the university. We're seeing cases that number more than 150, in fact, which is a huge rise compared to the fall semester. Most of these individuals are undergraduate students. And from what we've been able to ascertain by doing contact tracing and looking at the trends is that the majority of these cases are related to travel, to social gatherings, to social networks such as a fraternity and a sorority, and events that are not necessarily large events, but a lot of small events have contributed to these cases. We have seen multiple clusters of people from 2 to 10, where sometimes an entire household is impacted with everybody, all the roommates, everyone has tested positive. So it has been quite the experience, I'm sure, for the people affected primarily, because many of them have had symptoms, not everybody, but many have felt sick and needed some support. But it certainly has been reverberating in our community and has made us take some tough decisions, including changing the operating status of the university and suspending in-person and hybrid classes, which I know nobody wanted to happen, but those were very necessary measures in order to curb the transmission.
One of the significant issues I mentioned earlier, and we focused on this in last week's presentation as well, are the new variants of COVID-19 that have now begun circulating in the United States. Can you talk a little bit about these variants and what we need to know about them?
Well, I think people are very concerned, and this is the part about the concern part from your first question that is coexisting with some hopefulness. But the concern is about these variants because they appear to be more transmissible. So overall, I just needed to kind of give you context, is that viruses in general tend to mutate and change very rapidly, and this is not something that's unusual to this coronavirus. So it's expected that they would mutate and create new variants, and the virus has been doing it for a long time. The difference is that the variants from the UK, from Brazil, from South Africa, and even one from California seem to be more transmissible. So whereas in the past, one person with an old variant would infect maybe 1 or 2 people, these variants seem to be more infectious in that one person infected could transmit it to more than 2 or 3 people. And so scientists are still looking at why this is happening. There are all kinds of different theories, including that you need fewer particles to infect somebody because the viral particles are stickier, so to speak. And the reality is that they are here in the United States, even though they have originated from other countries. They are now present in several states, and I'm sure that there's even more And they've been here for longer than we realized, and are more widespread than we realized, simply because it requires special techniques of genome sequencing to identify them. And I think we're not doing the greatest job in the United States in sequencing the genome of some of the samples in the community. But they're here, they're more transmissible. There's some evidence that the UK variant may be also more lethal. It is not 100% certain that this is what's going on, but there's some evidence that's emerged in recent weeks that may be the case. And so this is what's causing a lot of people to lose sleep, a lot of scientists, people at the CDC and at the federal government, including us here in Georgetown and in DC. We have started working with the DC Department of Health on sequencing some of our samples to make sure and that we know what is causing these outbreaks. And there are a lot of questions. I mean, this is literally unfolding in front of our eyes as we speak. We're learning so much more every day, brings new information about these variants. We don't know whether somebody who had COVID in the past can be reinfected with this with a new variant. We don't know how effective our new vaccines are going to be with these new variants. And I know that there's a race, Pfizer and Moderna and others are racing to create boosters and new versions of their vaccines, so to make sure that they could be effective against those new variants. So there's a lot that we don't know still. And I think in terms of our individual behaviors, one of the questions is, what do we need to do to avoid these new variants? What change in practice do we need to take on individually? And I think one of the answers is we cannot let our guard down. We need to continue with all of the mitigation efforts. We need to continue with wearing a mask. We need to continue with social distancing. We need to continue with avoiding social gatherings. We need to continue with all of these instructions that we received since early April or since March. And it's tough. It's very, very hard to maintain the same level of vigilance, but I think it's absolutely necessary. Some of the conversations also include discussions about specific masks. Is it worth it? Should we all wear a surgical mask that is more effective than a cloth mask, for example? So there are a lot of things that we still don't know about these variants, and I think we're going to have to, if not maintain the level of vigilance, even increase it in the coming weeks and months.
Now, a moment ago, you described what is at the heart, a real paradox right now. Just as these new variants are spreading, we're in the early stages of an unprecedented vaccine distribution. It was perhaps unimaginable a year ago, as the coronavirus was just emerging, that we would have vaccines that are as effective on the coronavirus as these are. The challenge now seems to be able to move fast enough to get the vaccines to enough people and increase the protection across our whole population. Can you talk about what we're seeing with the vaccines and their rollout?
Yeah, I mean, I think as you describe it exactly right, that this is a race. This is a race against time. We need to vaccinate more people as the variants are spreading in our communities. It's a race to see who gets there first. And I hope that we can get more people vaccinated so they're not even infected with the new variants. But the rollout has not been great, to say the least. I think DC is doing a relatively better job than other states in terms of the proportion of the population that has been vaccinated so far. But we've had issues with supply. There are just not enough vials around the country to put in people's arms, and we've seen shortages. We've seen supply issues. We've seen supply chain issues in transporting vaccines to different places. And we've seen issues with the shiny portals that where people are encouraged to sign up for their vaccine administration if they're eligible, and those have not been rolled out in a technologically sufficient way. And a lot of people who are not tech savvy have been having trouble signing up. So there are multiple issues related to the rollout, and I think it will require a very concerted effort on the part of states and the federal government to get us more vaccines and to get more vaccines to more people as quickly as possible, so we can prevent infections moving forward and avoid having to deal with new variants, and make sure that the vaccines that we have right now can address and can help with the new variants as they start spreading in our communities. I think, again, to go to the hopeful side in terms of the vaccines, we are seeing some new kids on the block, some new vaccines that may get authorization in the coming weeks, such as the new Johnson & Johnson vaccine, a Novavax vaccine, AstraZeneca. Some of these vaccines are only have one dose, which may make their distribution around the country a little bit easier and faster and more efficient. But this remains to be seen. And again, as you said before, this is a race against time. There's a huge urgency in getting vaccines to every person currently in the United States.
Ranit, thank you. We're so grateful to you for your leadership and for everything you are doing to help keep our community safe. We could not be more grateful for your contributions as we continue to navigate this very challenging moment. Thank you for being with us.
Thank you so much, Jack. It's my honor to be here.
I look forward to seeing all of you again next week. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.